So now it's my honor to introduce today's speaker, Nikki Yuill, Director of Information Resource Center at LLS. We're excited to hear from Nikki and are confident that you'll gain valuable insights from her presentation. Thank you, Nikki. Over to you.
Excellent. Thank you all so much for having me today. I'm going to try to get my slides pulled up and bear with me if we have any technical difficulties. So let me see if I can share my correct screen. Give me just a second. And I think this is going to be the right one. Give me just 1 second. I'll put myself into, hold on. I can't see you unless I have to hit the share button first before I can hit presentation mode. Otherwise, I can't see my presentation. All right.
You're good, Nikki.
How does that look? Is that good? Awesome.
Yes.
All right. Thank you all so much. Well, I am happy to be here today. Give me 1 second. I got to get my other little screen set up so we're all good to go. But again, I want to thank Belinda and ECD Global Alliance for inviting me here today. And hopefully we'll learn a little bit about the Leukemia Lymphoma Society and also about my amazing group of information specialists here at the Information Resource Center. Just a little bit about myself. I am a clinical oncology social worker by training. I've been at LLS since 2018. And before coming to LLS, I had a very long 25-year career doing psychosocial oncology programming at a major hospital system in the San Antonio, Texas area. So a lot of experience working in the blood cancers, rare disorders, with solid tumors as well as blood cancer and with cancer patients throughout my whole career. I also want to share that it's also personal for me, the mission of LLS. I have lost 3 family members, my grandmother and 2 wonderful aunts, to blood cancer. So all of this in our mission that you're going to hear about is something very personal to me. So thank you for having me today. And we're going to get rolling because I've got a lot of slides to get through.
Nikki,
Yes.
I want to tell you that your slide deck is showing your notes
Oops.
for the first one.
Is that better? Okay.
That's better. Very good.
All right. So just a little bit about our presentation here and what we're going to cover today. We will have a few minutes at the end, I hope, if you all have any questions. But really today, I just want to share what LLS does and what the IRC does and how we can best help you. Okay. First, we'll start with our mission. Again, many of you are already familiar with the Leukemia Lymphoma Society, but our mission is to cure blood cancer and to improve the quality of life of all patients and their families. And significant ways that we do that is through research, advocacy, and direct patient support. And that's where my team comes in. All right, so let's get started. What is the Information Resource Center? Well, this goes back to LLS in 1997, way back, where we knew that patients and families needed one-on-one support to help guide them through whatever their blood cancer diagnosis was. This started in the first office was at our national office in White Plains, New York. And, back in the day when people actually had to go into an office. So this was all done out of the national office. And it was 9 to 5. And then around 2014, we were early adapters to trying to do some remote work. And we also expanded our hours from 9 a.m. All the way to 9 p.m. For better coverage. And then from there, after the pandemic, as many of you know, delivering patient support and care, the pandemic really changed things for so many organizations. We were lucky that we had already done some remote work before that happened, so we had an easy transition. But just to let you know that my whole team now of 19 information specialists, we're all fully remote. To give you an idea of the volume of folks that we help, we had over 25,000 inquiries from patients and caregivers in fiscal year 24. We reached over 13,000 households. Now remember, this is all blood cancer. So leukemia, lymphoma, myeloma, the myeloproliferative neoplasms, myelodysplastic syndromes, and of course, we cover ECD and some of the histiocytic diseases, mastocytosis, and some very rare blood cancers. Our breakdown, just thought this would be helpful. In fiscal year 24, 64% of our new contacts were patients and 36% were caregivers, just to give you an idea that we absolutely do serve both. Wow. All right. So how do we help patients and families? I'm going to put this slide up there, but we're going to talk a little bit more in detail once we get to the next slides. But this team is really about being on the front lines of answering questions from patients, from caregivers, from families, from healthcare professionals, anyone in that blood cancer community that needs support. We want to be that front door. We want to be the entryway to help connect you with exactly what you need. So I'm not gonna cover all of these, but I just want you to be able to reference back to this slide. All right. So who are these wonderful information specialists? Well, again, we are all highly trained oncology professionals. Most of us are clinical oncology social workers, and I do have one nurse. We also work closely with our clinical trial support center nurse navigators. We're in constant communication with them as well. Like I mentioned, we're available Monday through Friday from 9 a.m. to 9 p.m. Eastern. And we also can take chats, emails, and of course, calls are the main way that people can reach out to us. All right. Let's see. Okay, so again, 19 of us. I'm very proud to let you all know that we have 5 Spanish-speaking information specialists who are bilingual and bicultural. I am also bilingual in Spanish. I'm just not on the phones as much as the information specialists are. We also have an interpreter service that we use that has more than 350 languages that are available. So we never want language to be a barrier for folks getting the information and support that they need. It's also important to note, and you'll see that down at the bottom there, we want patients and families to connect with us as early on as possible, like in that diagnosis or pre-diagnosis phase, but we know that's not always possible, but that we want to walk with patients and families throughout the whole cancer experience, from diagnosis through treatment, through watch and wait, through potentially recurrence, all the way through hopefully long-term survivorship. And here's one of my favorite slides. So this is, I love that we have a picture, because when you call, or a healthcare provider or someone calls the IRC, you're not getting a call center. You're not getting AI. You are getting a real human being. And these are the real human beings that are on the other end of the phone when you call the Information Resource Center. We are spread out from coast to coast. These 19 amazing professionals, they are from Florida. I've got Florida, New York, Connecticut, all the way to California and Oregon, spread out throughout the United States, so that we can cover all of the time zones of our patients and families, from the East Coast all the way to the Pacific time zone. I also want to share that this team has a very diverse background. So not only are we all trained in educating about all of the blood cancers, but we also have this team that brings both pediatric and adult oncology experience to the table, as well as mental health counseling, palliative care, geriatric care, hospice care, crisis and trauma informed care, and just some amazing clinical background that creates this very cohesive team um, that puts the patients and families at the center of everything that we do. And one of the things that I think we'll have some time to talk about this a little bit later in the presentation, but is just the idea of how hard things are right now um, as a cancer patient, not just blood cancer, not just ECD, but we're really hearing this throughout the cancer world that the financial constraints, it is hard right now for patients and families. Not just dealing with the costs of a cancer treatment and cancer and insurance and premiums and deductibles, but the basic needs, that would be rent, that would be utilities, that would be food, transportation, um, the basic needs that patients and families are facing. And then you add a cancer and treatment diagnosis on top of it. And I think that's one thing that I want all of you to know, that when you reach out to the IRC and you reach out to the Information Resource Center, we promise that we will do everything that we can to look at your situation as a whole. Now, we may not have all the resources for it, but I can guarantee you that I want every single person to feel valued and heard at the end of that conversation. Even if we don't have the exact right resource that you needed, we will do our best to try to scour the earth to find an organization or a local, state, national resource that can help you in your quality of life. Okay, let's see. Now, I love this slide too. So at the Leukemia Lymphoma Society, we have a tremendous depth of patient and caregiver education and resources. And so we have our financial resources, we have our education and support resources that I believe Karen DeMauro talked about in the first of this series. We have our Nutrition Education and Services Center. We have family support groups. I mentioned our Clinical Trial Support Center. All of these programs that we offer are absolutely free and at no cost to patients or families. And that's really important. We want everyone to be able to have access to the support and the care that they need. One of the things that my team will do, if you call and get one of my information specialists, depending on what your need is, we will now, of course, if you're an ECD patient, we are absolutely going to get you connected back over with Belinda. If you're not already connected, we have done a wonderful collaboration of making sure that we get ECD patients connected with ECD Global Alliance because you are the experts. But we also want to be that additional safety net for additional support and resources for all of you. And this gives you an idea of kind of all of the information that the Information Resource Center is juggling. This is another slide, I think, that helps illustrate just how in-depth the resources are that we have available to you, and how my team of information specialists will work with you on a one-on-one personalized basis to figure out which one of these areas within LLS might be most appropriate for you, and make sure that we hand you off and we steward you to these other services. And if we don't have that service, our information specialists are going to make sure that we're connecting with other organizations. We also might be able to answer questions about disability or your health insurance, or what do I do if I have all of this medical debt? It might be connecting you to mental health and counseling resources. Like, I am just at my breaking point and I can't take this anymore. And although the peer-to-peer support was really good, I really feel like I need something more than that. Well, how do you access that? What's the first step? Anything that we can do to help ECD patients and families create a successful outcome, right? So how do we help you with your quality of life right now, but also put together any resources that we can to help you for the long term. And again, I think this is where the partnership between LLS and ECD Global Alliance can be super helpful to make sure that nobody falls through the cracks. Um, Now, one of the areas that I do want to focus on while we're on this screen, that Belinda and I and Kathy and we've talked about this before, about one of the things that we found out when we were partnering is just how many ECD patients weren't aware that they were even eligible for LLS services, right? Like right now, this might be the first time that you're thinking, well, it's Leukemia and Lymphoma Society, so I just didn't think ECD is a rare blood cancer would fit into that. Well, I'm telling you it does. So the one thing I want to highlight is our financial programs. Again, we just talked about how the financial needs are so high right now, not just in the US, but globally. So when our programs are up and available, I'll talk about this a little bit later, I want to make sure that you guys are getting connected to the programs that we have available to you. Okay. Next, I just want to briefly mention the Clinical Trial Support Center. This is another free personalized one-on-one service that LLS offers, and my team works so closely with these nurses. They are just the most compassionate, amazing nurses. Belinda, I know that your team also helps with clinical trials related to ECD. We have a full navigation service that's absolutely free that will provide this resource and a summary of all of the potential principal investigators, the clinical trials that they're eligible for, in a PDF format. And then you can take that back to your specialist, back to your doctor to review with. And again, there's absolutely no cost. The other unique one-on-one service that LLS offers that the IRC works really closely with is our free nutrition consultations. And I'm sure that Karen, like I said, may have covered this in the first part of the series, but I just wanted to, again, put a plug in for our amazing registered dietitians. This is also our only LLS program that is pan-cancer, meaning that it's for all cancers. You do not have to specifically have a blood cancer. This program and services is open to all cancer patients that can receive a one-on-one consultation with our dietitian. And the website is amazing. There's so many recipes and questions and answers and amazing content on the website as well. Okay, so back to the Information Resource Center and my amazing team that I have the privilege of directing every single day. What is it like? So what are we doing? Now, again, our bread and butter, what I want my team to focus on is that live call or chat that comes in real time. In other words, if someone only has 20 minutes on their lunch break, they're working 2 jobs, they've got this limited amount of time and they pick up the phone and they call LLS, I want to make sure that we're available. I want to make sure that they don't have to leave a message, that we can actually try to talk to you and figure out what it is that we can do and what the next step or the follow-up might be. So the majority of our work is done supporting patients, caregivers, right in real time on the phone or live chat until 7 p.m. Eastern time. And then we also respond to emails. Like I mentioned before, we do a lot of work with our clinical trial support team, educating about clinical trials and then referrals. My team also represents LLS through other advocacy organizations, coalitions, councils, and outreach, in addition to our time working directly with patients and families. We do a lot of additional research and monitor disease research and provide updates to our staff. And then we're constantly collaborating with all of the LLS departments and leveraging the expertise that we have here at LLS. All right, so I'm going to I hope we're doing okay on time. The next part of this is going to be some of the most common questions that we get here in the IRC, what we might hear in a typical day as calls come in. And again, a lot of it has to do with financial assistance right now. I believe about 38% of all inquiries to the Information Resource Center have a financial component. And compared to last year or the year before, it keeps going up. So we know that this is an ongoing, very serious concern for our patients and families. So again, some of the questions, they have a particular drug or treatment that maybe it's not on formulary, or sometimes they may not even have insurance. How do I get help with copay? How do I get help with insurance premiums? Newly diagnosed and they're just completely overwhelmed, right? I mean, cancer is so personal. It can just be absolutely devastating and overwhelming. And then you'll get some information, you'll get empowered, you're feeling a little bit better about it. And then a symptom or something, you'll have a setback, and it can really impact not just the patient's mental health, but the caregiver and the entire family. It's like when you take a pebble and you drop it into the water, the ripples go out to all parts of the family and your people that love you and your community. And it's important to plug in as much help as we can. Um, People finding the best cancer center or specialists. Now, ECD Global, I know you have an amazing referral network to get people connected to an ECD specialist. It is so important to see a specialist when you have a rare blood cancer or rare disorder. It's also important especially for ECD and many other blood cancers, is that a lot of times you need more than one specialist. So it might be that you need a hematologist, oncologist, but you might also need cardiology, endocrinology, lots of other specialists that you want someone that has some experience. So we can help with that. And of course, we'll get you connected to ECD Global. Paying for rent and utilities. Again, we're talking about financial assistance, treatment and disease information. And then we also get a lot of questions about what causes cancer or what caused my cancer. We get questions about if cancer is contagious. Can I give it to my children? Can I give it to my spouse? So I mean, it can range from a very specific research question to a very general, I've been diagnosed with ECD, am I going to die? So you never know what's going to be on the other end of the line. But again, what's most important for LLS, and I think ECD shares this with us, is making sure that we're always putting the patient at the center of everything that we do. And again, I'll go back to, even if we don't have the financial resource or the specific resource to help that you need right then and there, I want to make sure that people feel listened to and valued no matter what when they come away from talking to LLS. That is one thing that I think my team is absolutely exceptional at. And again, programs and services that we offer in Spanish. This is also something really important to LLS and to my team, is being able to reach out and talk to people in their primary language, if at all possible. And we have a really stellar set of information specialists who are bicultural and bilingual. Okay. All right, I'm going to jump into for financial assistance. This is one question, and I'm hoping you might have some questions about this when we finish and go into the question and answer portion, is the financial distress that's happening in the financial programs that are currently open. So with ECD, you're eligible for all of our financial programs here at LLS. Now, that's not to say that they're always funded in full and open, right? Sometimes you have to keep checking back. But the patient aid program, which is a $100 one-time only stipend, you would be eligible for that. That is open. We also offer travel assistance. That is currently closed right now. For folks that are going to CAR-T, we have this CAR-T program. Urgent need is also $500. This is a program must be completed by your healthcare professional to initiate the application. Again, this one's currently fully subscribed. We also have what's called local financial assistance programs that are based on grants by state and sometimes even by county. So it's always good to double check on our website, those local financial assistance to see if that particular grant is open in your area. You can also call one of my information specialists and we'll help you search for that. Copay assistance. This is something that can be really important if you're on a medication long term or you're in the middle of treatment. Our copay assistance program, ECD, is covered under the AML. Acute myeloid leukemia is the silo that ECD is covered under. That's not always obvious on our website or when you search for it. And right now, our AML copay fund is currently open, and that yearly amount is $4,000. And what you could use that $4,000 for within a 12-month period is just what it says here, is it covers insurance premiums as well as any copays related to your treatment. So let's say, well, Nikki, I'm not really on any medication right now. I'm in kind of a watch and wait. I'm not in active treatment. How would that benefit? Well, if you're paying $250 a month for your insurance premium, we can reimburse you for that insurance premium, and then you can use that money that goes back into your pocket for things like food or gas or rent. It can really help out even if you're not currently on a regular chronic medication. So, all right, let me keep here. Support resources. Again, I know that Karen may have gone through this in the first webinar, so I won't spend a lot of time, but I just want to briefly go through these slides. Make sure that you're familiar with some of our peer. This is our wonderful peer-to-peer first connection program for both patients and caregivers to try to match you with a survivor, and that is a one-on-one phone call. Our online support chats. Again, we do not have one that is specifically for ECD, but you can see we do have one for young adults, and we also have the second one there that is specifically for caregivers. We also have a new one for veterans that are living with blood cancer. LLS community. This is such a vibrant community and a great place to connect. This is where I think for ECD being so rare, you will find other people on LLS community that have ECD. So you can literally type in a question or support or anything that mentions ACD or ECD, and it will connect you with other folks that have already posted or may also be interested. So this is something I think ECD patients could benefit from. Our local support groups. And then on our education booklets, again, I know that Karen went through most of these, so we offer such a large amount of disease and patient support resources that I want to go through our webcast videos, blog. We have both a patient podcast and a healthcare professional podcast. We have our science blog and our education booklets. So the education booklets, I really want to pause and highlight just how helpful these can be. I think LLS, I like to brag a little bit, but I do think that LLS has some of the highest quality patient and caregiver information and booklets that exist. And I want you to be able to take advantage of that. We have our Erdheim-Chester disease fact sheet handout that you can download PDF off of our website. It's excellent. Again, not as in-depth as ECD Global, of course, but I do want you to know it's available. We also have these survivorship workbooks that I think could be really helpful. And there's 3 types of workbooks. So we have our survivorship workbooks that are specifically for adults navigating life during and after a blood cancer. We have those specifically for young adults, and then children and adolescents. So this might be another resource for all of you to think about connecting with. The other really amazing, I just think they've done such an excellent job with this, is our caregiver workbooks. I mean, there's strategies, there's what to ask the doctor, there's communicating with your family, financial, legal, health insurance information, and a tremendous amount of focus on self care and taking care of yourself as the caregiver so that you can be your best for the patient. Sometimes it's just so easy to always be putting the patient first that you lose sight of your own physical and mental health, and get burned out. So we really want to make sure that caregivers have that support and education and information that they need. So this might be another good resource for you all. The other thing I thought about is shared decision making, and this is really about empowering patients to think about their role in communicating their values and what's important to them when they're talking about symptom management, when they're talking about their quality of life and deciding on treatments moving forward, what is acceptable and what's not acceptable to them, and having that be a shared conversation with the physician. We have some excellent resources. Now, this is specifically for chronic leukemias, but again, I think it's appropriate, and I think it's translatable to the ECD experience as well. So I wanted to make sure to highlight these resources. LLS Health Manager. Of course, everybody's got to have a cool app. I think ours is pretty cool. This is our health manager. And then again, our Office of Public Policy, and Policy and Advocacy. This is another thing that we have in common with ECD Global Alliance, again, about what are the macro level system and policy changes that we need to work together with as advocacy organizations to make sure patients and families can access the life-saving care that they need. And I think LLS has done a great job. And my team, again, in the Information Resource Center, is on the front lines of hearing these concerns and what's happening in the lives of patients and families every day. Okay. Now, for all of you, if you don't mind, make sure that you put this phone number in your phones for the Leukemia Lymphoma Society, for the Information Resource Center. It's 1-800-955-4572. So maybe you've already connected with LLS, but you meet someone tomorrow or the next day, or you're in conversation and you find out that your neighbor's daughter was just diagnosed with leukemia. Get them connected to us. You please, please, please feel happy or feel good about connecting people to LLS as an extra safety net and layer of support, not only for yourself, but for anyone who has been impacted by blood cancer. I want to promise you that we will take good care of every single person who calls, and we'll absolutely do our best to plug in all of the resources and support that we can to help our patients and families. And next, all right, that's a wrap for me. I would love to open it up for any questions or any other conversations.
Okay, Nikki, we've got a question. Says, I'm a caregiver to someone with ECD. Can I still call LLS for help?
Absolutely. Yes, you are our target audience, whether it's the ECD patient or the ECD caregiver, or even just a family member. Maybe it's someone who's not providing direct caregiving, but lives across the US and just, again, wants more information. Now, again, the good news is you're already connected with ECD Global. So that makes me feel good. But absolutely, as a caregiver, we have all kinds of caregiver robust support groups, our caregiver workbook, and just really want to make sure that you have everything that you need.
Okay, we have another question. How do I know when to call ECDGA or LLS for help?
Ah, that's an excellent question. Honestly, I really think ECD Global Alliance is probably going to have more specific resources. For example, your referral network, getting you connected with another ECD patient. So, for example, our First Connection program may have a few ECD patients that are trained volunteers, but ECD Global may be the have more robust because again, it's a rare disease. So people, they are a registry. So what I would tell you to do is make sure that you're connected with both, right? And as long as you have the support from both of us, I think you're going to be covered.
Okay. See, there's one more. I've heard that sometimes LLS has funds to help patients and sometimes doesn't. How do I know if there are funds to help me?
That's such a great question. Yes, and honestly, it just breaks my heart that when we are fully subscribed in our financial programs, again, we rely on donations. We're a nonprofit organization. That it's we know that the demand is so very high, and that the supply doesn't always meet the demand. So, what you can do is, I would suggest for people, you can do two things. You can periodically go to our LLS.org financial resources website, and it has like that slide I showed you. It'll have the list of copay, what copay programs are open, if urgent need is open, if any of the travel assistance. You can literally scroll and just check on that. You can also call any of my information specialists. So you could call the 1-800-955-4572 phone number and just say, hey, I'm checking to see if any of the patient financial programs are open. We would also, if you call us, we're also going to make sure to check, are there any other sister organizations or other programs that outside of LLS that might be offering financial assistance that we can encourage you to reach out to.
Good. Well, it looks like we've addressed all the questions. Thank you, Nikki, for a great presentation. So thank you all for being here. That concludes the presentation for today. If anyone has any questions, please contact ECD Global Alliance.